You are live on 24 Hours Fertility Conversation with Abim Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you are live on 24 Hours Fertility Conversation. Welcome back. I believe you're enjoying us. I believe we're hearing from our daddy, the CEO, Abim Fertility and Andrology. Tonight is a 24-hour live conversation, 24 hours fertility conversation. We're going to be hearing a whole lot of things. In a few minutes now, you are going to be seeing another face, a doctor, very soon. Okay, Daddy, before we round up this session, I want to ask some little question about Abim's Fertility. What inspired you to establish Abim's Fertility and Andrology?
Because I want, like I tell you,
like you said,
saying like I said, I want many women. I want many women to be helped by me, by my practice.
And let me ask this question. From your talking since when we started this conversation, you've always said you want a lot of women to have their own children, maybe people that have infertility and stuff like that. Why? What inspired you to women? Like, what passion do you have towards women like that? Maybe women looking for the fruit of the womb.
Well, you see, I said not women alone, but it's because our society, they stigmatize women or woman when they have not gotten pregnant. And at times you find out that not majority of them have problem. The husband could be the source of the problem. But notwithstanding, our society will still cast aspersion on women as if they are the sole bearer of the problem. So that is why, and woman is a weaker vessel. So that is why for me, I believe when I'm growing up, I don't know, because my mother did not suffer infertility. My father did not suffer infertility. Because the story was my mother gave birth to me when my mother was very, very young. So,
wow.
So if I say I grew up and I started practicing this way, maybe because of what the way God wanted. I told you that right from when I was told that the prophet have told my mother that this is what I'm going to do.
That you will wear white gown. Daddy, can I ask this question? Like, while you started Abim's Fertility, was there a time you feels like you should just close down?
No. When I started from having a lab to now that we have, I've never in any start. Even when the problem comes, my own is let's solve that problem. So now say, I want to go back. Go back where? To where? When you left, if you left, if truly you want to live in Egypt, you will not care to cross the Red Sea.
Yes, no.
That is how it look like. There's a serious challenges, financial problem, when there's a stagnation, but it has never occurred to me. Say no, I want to change line of work, I want to change line of career, or I want to go back. No, it has never.
It has never. What now makes Abim's different from other fertility diagnostic centers?
We are different. Why we are different is because our center domicile different type of different cadre of skills. You see, when you listen to that, when you see our names, Abim Fertility and Andrology. Andrology is not just a name we added to our name, just a word added to our name. So why we are different? Because of reliable results and patient-centered care and quality service.
I like that. This question comes, does Abims provide sperm banking and cryopreservation services?
It's part of our core work. We do cryopreservation, both male and female. In female, we are talking about embryos and egg. In male, we are talking about the semen. It's one of our services.
Wow. So what plans do you have for expanding Abim's fertility?
We pray to God that in the next, not even in the next 5 years, maybe by next year,
wow,
God will help us so that we can have a center that captures patient welfare. Not that I'm not saying we do not have welfareism to our patients now.
No.
But we are thinking it like some of our patients that used to come from abroad for procedure. We are praying that in the next 1 year, maybe when we have our hospital being built, then we can keep them.
We have beautiful place they can lodge.
Very close, or when we inside the hospital, a conducive place so that we can monitor them.
Wow, wow. So how can viewers at home now, how can they book an appointment or contact Abim's Fertility and Andrology?
Our office, our address is 25 Olowu Street off Awolowo Way, very close to Ikeja under bridge. And our consultation, physical consultation is free. It's free. And yes, our consultation is free. Unless you want a big man consultation, that is when we are going to tell you pay small money. But if you just come early, you can see me. And we work Monday to Saturday from 8 a.m. to 4 p.m.
Okay. Daddy, we have a lot of questions here. So I would say if time permits us, maybe tomorrow we will be addressing some of the questions again. But finally, what final message would you like to give everyone joining this 24-hour conversation tonight?
The final message to them is, let me first thank them for me to keep them awake. That's number two, I want us to, as much as possible in this 24 hours of a thing, to please stay with us. Because we have many people, proper experts that we are bringing up that they will learn from them.
You should come and learn. Come and learn, interact, and so on and so forth. So Daddy, for this segment, that is all you have to say. Okay. Our viewers over there, I'm rounding up this segment right now. I want to tell you I'm so happy that the 24 hours live fertility conversation have started, and we know that we are going to be learning a lot. It's going to be an interactive section. It's going to be an impactful sections and lots more. Like, I'm leaving this place now. Another person is coming. She's a doctor, and so much will be learned from her. So don't go away. Stay tuned. We'll be right back. With Abim's Fertility and Andrology, a 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon.
Okay. Welcome back. Now with me here is this another guest, and it's a woman, and is going to talk to us about what do you call the topic?
Menstrual cycle.
Menstrual cycle and
fertility.
You know, majority of you might have been listening to me. I used to discuss about infertility in women, menstrual cycle, but thank God, in the studio with me is Dr. Oladejo. Did I pronounce your name very well?
Yes, sir.
Yeah, Dr. Oladejo. Dr. Oladejo is working in Abim's Fertility and Andrology, and he's here with me to tell us about menstrual cycle and infertility. Dr. Oladejo, what is menstrual cycle?
Okay, before I answer the question, I would like to say good evening to everyone, or good day wherever you're watching us from. Thank you for joining this amazing show. And thank you so much, sir, for the privilege to be part of this 24 hours live stream World Record Breaking Fertility Show. It's an honor to be here, sir. Thank you so much. And my name is Dr. Oladejo Shakira, and as my Oga rightly said, I am one of the fertility physicians at Abim's Fertility and Andrology. And now, to answer the question, I will try as much as possible not to use so much of medical terms here. So I'm going to be explaining in a way we can all understand. Menstrual cycle is a series of monthly hormonal and reproductive changes in a woman to prepare for pregnancy.
So now, like you said, that it's a series of events,
yes,
hormonal changes in women. Okay, what is the difference between menstrual period and menstrual cycle?
Okay, menstrual cycle, as we said, that is a series of events going through a woman's body. It can be emotional changes and reproductive changes. And this menstrual cycle involves four phases, which includes menstrual phase, follicular phase, ovulation phase, and luteal phase. And these all happen in the in about a week, sorry, in a month, because typically menstrual cycle is between 21 to 35 days. However, for a monthly period, it usually lasts between 2 to 7 days. That is, it is a time when a woman sees a monthly flow, when a woman is bleeding. For menstrual cycle, it consists of lot of things in that cycle, but for monthly flow or for period, it's just a period the woman is menstruating.
Okay, that means menstrual period is the number the number of days that the woman see the period.
Yes,
Yes,
sir.
and the cycle is the number of days that it take for you to see
Your
another
bleeding,
period.
yes.
Okay. Now, what do we call? I don't want us to start speaking our grammar here so that a lot of people in the house will understand. When the menstrual period is become painful, what do you think can make a woman to have a very painful menstrual period?
Okay. When we're talking about painful menstruation in medical, we call it dysmenorrhea. When menstrual cycle becomes, so a monthly flow becomes very painful. Normally, menstruation is not ought to be painful as well. It's not ought to be painful at all. But when it's becoming painful, we can think about some problems going on in the uterus, that is in the womb, from adenomyosis to endometriosis to uterine myoma, that is fibroid, even some problems from the ovaries as well, like polycystic ovarian ovaries syndrome, endometrioma. Those things can actually make a monthly flow, which is period, to be very painful.
Wow. Um, that is a brief explanation. That's a very brilliant explanation. Now, when we say a woman ovulates, what does it mean that this woman is ovulating?
Okay, I would say, we said earlier that monthly cycle is a series of events going on in a woman's body, and one of them that we mentioned from those events is ovulation. Menstruation follows by ovulation. Ovulation is when a mature ovum is being released from the ovaries, from the dominant follicle actually in the ovaries. What do I mean by follicle? For some of us who doesn't understand, we already said we won't be using so many medical terms here.
Yes.
I usually describe follicle where the egg comes from as a bag of sack. Let's say we take a nylon, we put water inside, then we burst it. The content comes out, right? So I usually describe follicle as something like that. When we have a mature follicle in the ovary, the content inside is the egg. So egg is not what we can see with our face. And during the time of a woman's ovulation usually lasts between 12 to 36 hours to 24 hours. So that is when the mature egg is being released from the follicle in the ovaries, and this happens at least if there is no problem, if a woman doesn't have any issues, this should be happening every month. The only reasons why a woman may not be seeing her period every month is ovulating every month is some medical issues, which I believe we'll still get into later.
Okay. Thank you, ma. Like we have a lot of causes, different causes that can make a woman not to get pregnant. One of them is blocked fallopian tube. How do a blocked tube can affect a woman from getting pregnant?
Thank you very much for that question. Okay, let me break this down a little bit. For when there is blocked fallopian tube, there could be partial blockage or complete blockage. We've seen some women who say that, their tubes were blocked, but eventually they conceive. Some of them could be partial blockage, that sperm can still be able to swim through a little bit and be able to fertilize the egg. But in case that there is complete blockage, and what usually causes blockage is when there is inflammation of the fallopian tube that eventually leads to scarring. when there is scarring of the fallopian tube, and it's a complete scarring of the fallopian tube, the sperm may not be able to swim through to be able to meet the released egg from the ovary to be able to fertilize it, and in that way it can lead to infertility.
Wow. So if there's a blockage of tube, what would you suggest to a patient?
Okay, we usually give benefits of hydrotubation, that is tuber flushing. That is when fluid is being introduced into the fallopian tube to see if it can help to clear the blockage. But in the case that hydrotubation has been done and yet there is no clearance, I mean the tubes were still blocked, it might be coming from a complete blockage from scarring, that is from severe inflammation of the fallopian tube, and in that case we usually suggest the patient to go for IVF.
Is it only hydrotubation that a patient could employ to attend to a blocked tube?
There are no medications that are guaranteed to clear fallopian tube at the moment. Even hydrotubation is 50-50 as well. It's not 100% sure that it works, but yeah, we give it a benefit of it.
Okay. How do age affect women in terms of fertility?
Okay, you know, one of the causes of infertility is actually associated with age. There is something we call age-related infertility. That is, as a girl child, we're born with all our eggs. At every month, a woman at least have to release one egg for a conception to occur. And as the age progresses, the quality and the quantity of this egg tends to reduce. So anything from the age of 35, it's expected that ovarian reserve, that is the quantity and the quality of egg, will start declining rapidly from the age of 35. And in that case, anything from 35 upward, the chance of a woman conceiving naturally begins to reduce due to the age.
Okay. Now, if we want to investigate a woman for fertility, what are the tests you would suggest that you think a woman should do?
Okay, sir. So if we are investigating infertility as a doctor, one of the things I do first is to take history, a proper history to let me know what I want to investigate, take a history of my patient, take their complaint as well, and then we can now send for investigations. And one of them is, one of the very important things we have to investigate is a woman's hormones profile. We have to know what is going on with a woman's hormone. We have to be sure of the quality of the eggs. We have to be sure of the ovarian reserve. That is when we do AMH. So basically we do AMH, we do full hormone profile, estradiol, which is very important. We do transvaginal scan or even pelvic scan. That is basic fertility testing. And then we can now go, if everything is fine and there is still infertility, we can now go further to advanced investigations like HSG, that is hysterossalpingography. If it's fine, we can go further into hysteroscopy. But these are all step by step.
Okay, thank you, Dr. Oladejo. I want you to explain the differences between IVF and IUI.
Okay, that's very simple in a layman's understanding. IUI is intrauterine insemination. The way it sounds, intrauterine insemination. That is, intra means within, uterine means the womb, and insemination is to inseminate something, to put something. That is how I usually break it down for my patients so they will understand. It means that a man has to produce sperm, or however, a man has to produce sperm, and a lot of processes are going to be done, like sperm washing on the sperm. After then, we're going to inseminate this sperm around a woman's mid-cycle, that is around the second day of her period. What we do is, when a woman sees her period, we ask her to come day 2 or day 3 so that we can place her on medications to ensure that she ovulates, possibly with injections too. And we do scan to monitor until we ensure it's our mid-cycle, our ovulation window. And when we confirm that, we can now take the sperm that is being washed already. We take the best from those sperm, then inseminate it very close to where the egg is being released. I mean, on the uppermost part of the uterus, so they can swim. It can swim easily and and move towards where the egg is waiting patiently for fertilization. And for IVF, IVF is another assisted form of reproduction, which involves taking the sperm from a man and taking eggs or egg from women. That means we have to stimulate a woman as well. But in this case, instead of putting the sperm in a woman's body around her mid-cycle, we have to retrieve these eggs. When the egg has been retrieved, it's being fertilized outside a woman's body. In IUI, we said we inseminate, we put it in our body, but in IVF, we actually do fertilization outside the woman's body, and after a few days, when embryo is being formed, we transfer into the womb.
Okay. And at what point will you suggest any of these procedure to maybe to a couple or to a woman?
Firstly, one of the things that I love to do in this case before advising is when there is unexplained infertility. I mean, when we've checked everything, the sperm is good, hormone is balanced, AMH is good, a woman is ovulating, but yet there is no conception and tubes are open as well, we can suggest IUI. But IVF, I usually, for me, age is very important, because there are some patients that you will see and you will know it's better you do IVF due to the age, due to the quality of the eggs, I mean the ovarian reserve. So those things, age and the ovarian reserve, is one of the things I look out when I want to suggest IVF to the patient. But for IUI, when there is sometimes patient request for it, and sometimes when there is when they've been trying and there is no conception in case of unexplained, then we can give a shot for intrauterine insemination, which is IUI too.
Okay. Thank you, Dr. Oladejo.
You're welcome,
What I
sir.
want to ask you is, in your years of practice, that you have been seeing couples, whether male or female, or couple together, have you ever seen a situation whereby yes, we know that we see people, they are seeing period, we expected them to get pregnant, but when they go and see their period, has there ever been a situation whereby you yourself will break down with the patient when they do not test positive?
Many times. Many times, especially, in fact, what you said, it just really bring back a lot of memories. When I will see lots of couples, they are even young, and everything seems to be going right, and expectations are high from the couple, even from the doctor, like, oh no, you have these dominant follicles. In fact, you're producing up to 2, and the sperm count is good. We do everything. At the end of the day, there is no pregnancy. Yes, those moments I actually break down with my patients. Like, they're crying, I'm crying. Sometimes I just wish I have this supernatural power to just like grant their wish almost immediately, but it's not possible. So I just encourage them that if you don't try, you won't know the one that will work. So we have to keep trying. And one of the things I say to help to motivate them is, I am not giving up. So I encourage you not to give up as well. So we keep trying till we have our result. That is my slang. We keep trying till we have the results. No results, no giving up. So yes, there have been lots of moments like that. Prayer sessions, like we'll be praying like God, yeah, it has to work. Yeah, multiple times like that. Yes,
Okay.
sir.
Thank you, Dr. Oladejo.
You're welcome,
I
sir.
want to find out from you. People say it take 2 to tango.
Yes, sir.
So if you see a situation whereby a man said, nothing is wrong with me, I'm not doing tests, and the wife has been coming 1 month, 2 months, 3 months, 4 months, what would you do? What would you advise the woman when the husband is saying, I'm not doing tests?
As a doctor, I don't hear I am okay, I have to check what is going on. Even if you have had 10 babies before, as long as you have a partner that is currently trying to conceive, you have to come and do tests. So in that case, when I have women who their husband is saying they're okay, they have kids before and they're not the cause, sometimes I ask them, can I talk to your husband? Okay, call him, put it on speaker. Then I have to explain the same thing you just said now, that it takes two to tango. I used to, some of them, I would tell them that maybe before you even had those kids before, there may be a low sperm count. However, over the time, because you do not know, it can get worsened. Okay, you have your baby maybe 3-4 years ago. If there was low sperm count, it's just probably mild. After 2-3 years, it can become severe. That is severe oligospermia. So I just give them all series of lectures, counsel and even support. Another thing I tell the man whenever I'm counseling or trying to give them motivation to come for tests is that you can just come and do as checkup. Just see it like you want to just check yourself just to be sure you're fine, so that we will know where to focus more on, maybe is on your wife. So yes, I like to encourage, motivate, very important, and do counseling as well, because I want to see results, especially when the woman has been coming in and out, yet there is no result from the man. Yes, lot of counseling and motivation there, I always do.
Thank you, Dr. Olade.
You're welcome, sir.
On a final note, before you go, what is your advice for a young couple that they just married and they're like 3 or 4 months into their marriage? Are you saying they should wait more, or they should go and do tests? What would you advise?
Wait more? No, I'm not encouraging any couple to wait more. Even if you're not trying to conceive, it's always good to check your fertility status. That is the word I use. Check your fertility status, even if you're not ready to conceive. Because we eat so much of unhealthy food lately that can mess with our system. And a woman's cycle or a woman's hormone can easily be messed with poor diet, severe stress, whether physical stress or even mental stress. Lack of sleep. We're all guilty of all this. Lack of sleep, unhealthy diet, from fast food to fried food and so on, and even stress. So we're all guilty of these. That is why it is suggested for every woman, the moment you get married, even before, if possible, try to be checking your fertility status once in a while. Do not wait until it gets to that level that you start waiting for years to conceive before you start checking yourself. The moment you conceive, or even before conception, carry your partner, all of you, let your husband do or your partner do a semen analysis while you check your ovarian reserve. It is very, very important, because the rate at which ovarian reserve is declining rapidly lately now in young women is very alarming. And the earlier you know, the earlier the better. So you know the right supplement to start taking to be protecting your eggs by the time you're ready to conceive. So I would not suggest or advise any couple to wait for a couple of months before starting to check their fertility status.
Okay, if you are telling me, I think we will need to release Dr. Oladejo now. Dr. Oladejo, thanks. I want to say thank you for coming on the show. And I believe that when we call you some other time, you will come.
Definitely.
You are welcome. We say thank you. God bless you.
Amen.
We will have to go on a short break, and we will come back.
Good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology.
you said on your end. Okay. As you said,
Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love.
We are back. With me now is another speaker, and what I have with me, the fertility guru I have with me right now is Dr. Abiodun, and he is the CEO Pro Broyo. Am I correct?
Pro
Brayo Fertility Clinic, and their center is at Ikeja. What is the sir? Could you please introduce yourself properly?
Oh, thank you very much. Thank you, viewers. I'm super excited to be here tonight to educate our viewers. And first of all, I want to commend the CEO of Abims. I must commend you. You're doing a fantastic job. And this is going to really create a lot of awareness among our people and our colleagues in diaspora and our people, Nigerians in diaspora. So well done. Kudos on this. It's a fantastic feat, worthy of commendation. So thank you very much for inviting me. My name is Dr. Abiodun Hamzat, the CEO of Pro Brayo Fertility Clinic, number 30, Oba Akran Avenue, Ikeja, Lagos. Okay, thank you for having me.
Yeah, thank you. Well, you are welcome, sir. Yeah. We want us to discuss surrogacy. What is surrogacy?
Well, surrogacy is just an English grammar, but I would like to break it down to our people, and I want to invite our viewers to sit tight and listen to get educated tonight. What is surrogacy? Surrogacy simply means a situation, a fertility intervention where someone other than the intending parent carry pregnancy for them, so to say. That's just simply what it means, though there are different categories which I'm going to break down later. And there are various reasons why people do opt for surrogacy. People don't just wake up and say, I want to do surrogacy. There are some factors that must be present to say, okay, that's the only option they can go for. Okay. It's one of the fertility intervention which is widely accepted all over the world, not only in Nigeria and in India, UK,
But you say
Canada.
it's widely accepted.
Yeah.
But I thought in this part of the world we are just trying to embrace, because of the way that process look like. Like people do it secretly before.
Yes, the reason is not far-fetched.
Okay.
It's simply because there is not currently an enabling law
Okay.
that supports surrogacy in Nigeria. In some other climes like India, like America, European countries, there are enabling laws the people must follow. But it's now gaining acceptability even in Nigeria, even though law is being promulgated currently. I think I quite understand that there's a law currently with National Assembly to guide surrogacy procedure in Nigeria. So generally, yes, people can be doing it secretly, but it's widely acceptable. People have done it.
Okay, Dr. Abiodun, tell us different type of surrogacy that we have.
Okay, there are basically two types of surrogacy. One is gestational surrogacy. The other one is traditional surrogacy.
Okay.
And let me quickly break it down.
Yeah.
Traditional surrogacy is a situation where the surrogate egg is being used, and donor egg or donor sperm or intending sperm is now transferred into the surrogate to create a baby, to form embryo and subsequently carry the pregnancy. Traditional because it is the egg of the surrogate that is being used in this place.
Okay.
That's why it's traditional surrogacy. The other one is gestational surrogacy. In that situation, it's either the egg of the intending parent and the sperm of the intending parent, or a donor egg or the sperm egg that has already been formed, that is used to form embryo, and now transfer into the surrogate.
Okay.
So in that situation, the surrogate has no genetical sharing with
The baby.
at all. But in traditional, the surrogate is actually the mother, is the supposed mother of the baby. But it depends on the kind of agreement that that was established before the surrogacy is being carried out. And there are two types of financial involvement.
Okay.
There's a part that people have to be compensated for agreeing to be a surrogate for intending parents. The other one is altruistic, where people do it to just help their family member, their friends, or whoever they know and they care for, and to say, okay, let me carry it. I'm not going to collect any money from you, but of course the legal fee, every other cost that is involved in the surrogacy will be borne by the intending parents. So that's just the types of surrogacy that is available.
Yeah, there's something I've heard before. I don't know how you are going to look at it. As I was a particular time, a surrogacy company was telling me somebody want to do surrogacy program, but by IUI. And I said, no, you can't say you want to do, if you want to do surrogacy program by IUI, that means you want to cut a lot of expenses. I mean, IVF expenses.
Sure.
If anybody, I want to ask you, Dr. Abiodun, if everybody want to do surrogacy by IUI now, do you still believe that person is doing surrogacy program?
Yes, I want to agree that it's still surrogacy. Just from what I said, surrogacy doesn't necessarily mean IVF must be done.
Okay.
Because in IVF, of course, we collect the egg out, we collect the sperm out to form the embryo and transfer. If someone now wants to do using only the sperm through IUI, it's still surrogacy, because in the language, in explaining the language, it's still another person carrying another person's baby. It's surrogate carrying the baby. It's only that the IVF part is removed.
Okay.
That is at least the external intervention, the laboratory intervention has now been removed.
Okay.
So it's still surrogacy in a way,
Okay.
provided the donor of the sperm is not known,
Okay.
because that can really cause a lot of problem. So And of course, most of the time, it's not the best to go for traditional surrogacy because the bonding is always there.
Okay.
From whoever donates the egg, whether the surrogates or whoever, it's better to keep all this information anonymous.
Okay. Now, as an expert, at what point will you advise women or a woman to do a surrogacy?
Okay, so
what are the factors?
Okay, there are so many factors, and I'm a classical example of, as someone that has done surrogacy twice.
Okay.
It's an interesting story, but let me speak generally now before I come to my own personal story. If a client has had like 4, 5, 6 IVF, and it ended up being negative.
Okay.
Such clients, they are likely to be a candidate for surrogacy, and I will explain briefly.
Okay.
You see, like you and I know, in IVF procedure, the quality of the egg we can determine in the laboratory.
Okay.
The quality of the sperm we can also determine in the laboratory.
Okay.
But the only one that's always hidden from us is the quality and the acceptability of the embryo to stick in the uterus. So now, we have done everything right in the laboratory by getting quality egg, quality sperm, but the womb where we are putting this thing could be the challenge.
Okay.
So if a woman is passing through the first IVF, the second IVF, the third IVF, and is ending up becoming negative, or recurrent miscarriages.
Okay.
So surrogacy can be,
can
be advised for such patients. Another patient in that category is a woman who doesn't have uterus at all. Probably the uterus has been removed because of either complications or multiple fibroids. So such uterus now, of course, may not likely be able to carry pregnancy. Such clients can be advised to go for surrogacy. Another category is patients that, of course, is managing serious diabetes, serious hypertension, knowing fully well that when you do IVF for this kind of patient, because you are likely to, of course, you are going to remove the egg to create the embryo, and this can endanger the life of such a woman. So surrogacy can also be advised in that category of people.
Okay.
And of course, age
okay.
is very, very important. The current law now by Lagos State government through a farmer is that we should stop surrogacy at 52, 53 because of likely complications that may likely come up from such a woman. All of us know that when all over the world, once one is up to 50 years, any health challenges can come up, like diabetes, hypertension, whichever form of ailment can come up. So when you now put embryo in such patients at that age, and health challenges come up because of that, who do we save now? Is it the mother or the baby? So such patients, you have to, of course, recommend surrogacy for such people.
Okay. Thank you, Dr. Abiodun.
Thank you.
In surrogacy, people believe that if they do surrogacy, it must come out positive. Is it true?
No. See, I encounter this kind of problem every now and then. And whichever way we want to look at it, surrogacy actually have the highest success rates. And I will explain briefly.
Okay.
Because in surrogacy, you are very, very sure of the quality of the egg you are using.
Okay.
You are very, very sure of the quality of sperm you are using. You are also sure of the womb you are using. Sure in the sense that whoever is going to present herself as a surrogate must have given birth successfully before, either through vaginal delivery or CS, but at least the person has been pregnant before. Which can give us some level of confidence that this person
woman carried pregnancy before.
Yes, that this person is likely to, deliver, to carry pregnancy successfully. So because of that, it tends to increase the success rate among all kind of procedure. In the other one, like IVF now, and if a patient that is around 38, 40, or 41 or 42 says, I want to carry my baby myself, and this person has never even been pregnant in the past.
Okay.
We're not too sure of how the success rate is going to look like in that kind of person, unlike surrogacy arrangement. So now, going back to your question that people expect surrogacy arrangement to be positive at all times. No. Like I always tell my clients that, see, it's not even a woman that is even young, 15, 16, 17, 20, 25. It's not every month a woman can even get pregnant in the first instance.
Yes.
No matter how fertile that woman is, it's not every month. It's not going to happen. So if it's not happening to someone that is even very fertile, how are you sure that the surrogate will get pregnant at once? And don't forget that we can get everything right, and yet we don't get positive results. So it's not correct that you must do surrogates, must be positive at all times. We don't do that. Most of the time, in our own clinic, once a surrogate is negative for the first time, we don't use surrogates second time for the same client.
Yes. Okay.
We change the surrogates.
Okay. Now, you said you want to share your story with us before I ask the next question.
Okay, so I'm a victim of this surrogacy, and that's always an interesting story for me to say.
Okay.
Actually, I got married like 26 years ago, and for a good 6 years, we couldn't achieve pregnancy. But at the end of the day, I was able to stimulate my wife, correct the hormonal imbalance, and she got pregnant. My daughter now is 20 years old.
Okay.
So after that one, we had another one, 9 months after, which ended up in the stillbirth at 8.5 months.
Okay.
Now, between that period and 2019, which makes about 10 years, my wife did 5 IVF.
5 IVF.
5 IVF that never came out positive. So, of course, age was running out, and we were becoming impatient. So we now had to say, okay, the 5th one, we said, okay, can you, with the IVF clinic we use, can you put in my wife and put in a surrogate as well?
Okay.
At least to be double sure, to be at least to have higher success rate.
Yes.
So for the 5th time, my wife became negative, and the surrogate this time around got pregnant.
Wow.
So that makes, give her the second child, which is 6 years old right now. So 4 years after, or 3.5 years after, my wife now said, no, now. You now have an IVF clinic. How do we know that your DBI know what it's doing? So you have to do it yourself. And for me to be sure that you know what you are doing after all the trainings and all that. So we did another one for ourselves, and that became positive for the first time as well.
Okay.
And that's our second surrogacy
that means
story.
they carry the pregnancy herself?
No, surrogacy.
Surrogacy again?
Yeah, it was a surrogate we used the second time and the third time.
Okay.
So I have 2 children from that.
Okay. Okay, thank you for sharing, because I said if some people, they won't let you know that this is what I've done to afford these children in my house. You see, I've even seen cases before whereby somebody that did surrogacy went to church, do Thanksgiving, and tell the whole church that this is how this baby come. That is, like we rightly said, people are now start embracing surrogacy now. Now, what I want to ask you is, what are the challenges in the surrogacy program? I want to talk about the challenges, about some of us, we use agency to work with, although we have some clinic that they are the agency on their own. But challenges I'm talking about is whereby we normally have not, it has not happened to me, and whereby they say somebody got pregnant, a surrogate now run away with pregnancy or whatever. What do you think it can bring that kind of problem in surrogacy program?
So once bitten, twice shy. We've learned from experience and from the experience of others. And most of the time, it's only a fool that will wait for him to commit error before learning.
Okay.
So what we do in our own clinic is that to forestall this super story that may come after surrogacy procedure, people write application to us.
Okay.
As if they're looking for a job.
Okay.
They apply to be a surrogate. We check them mentally. We test their level of intelligence to be sure that, yes, the kind of surrogate we are going to have is not going to run away, with someone else's baby. Another thing we do is to ensure that they give us a guarantor.
Okay.
They bring their guarantor, they supply their NIN, their own and their guarantors NIN. We locate their address. And of course, they also go to High Court to do affidavit for us to be that the baby they are carrying does not belong to them, so that there can be some level of safety for our organization and for the intending parents. We try to do all these things to forestall any eventualities that may want to come. And of course, yes, we use agents, and sometimes we use our in-house arrangement to ensure that we monitor these surrogates, because sometimes they can be funny. We have seen situations of surrogates that got pregnant, and for a reason we don't know, they lost the pregnancy.
Wow.
So whether they aborted the pregnancy on their own, we don't know. That's why we always test their level of intelligence and their level of education, and we counsel them enough to be sure that, and we explain the patient situation to them, that this is the situation, so that that feeling, that empathy, they can also have it to help others to carry their pregnancy.
Okay. Dr. Abiodun, surrogacy is not cheap.
Yeah.
How do you think it could be affordable?
Honestly, if I tell you I know how it can be affordable, I'll be lying to you. It's a big thing, all over the world, and I want to inform all our viewers right now that Nigeria has one of the lowest country, when it comes to fertility management.
Okay.
We have seen situations whereby people send their embryo from United States, from Canada, from UK for surrogacy procedure in Nigeria. Because abroad, for example, US that I know very well, to even do IVF doesn't cost anything less than $25,000, excluding surrogacy. And if you have to do, if anybody is to be your surrogate in America, for example, can you even take care of the health insurance of that person? Can you pay this person living wages in America? This is huge. It's huge. Then all these Western countries, their mentality is different from ours. If some of them want to have empathy on the patient, yes, they can have the empathy. But some of them can just be nasty sometimes, and they carry someone's pregnancy and it got spoiled, and you have no one to blame. So the cost is even huge outside. And for me, generally, when people tell me something is expensive, the next question is compared to what?
Okay.
Compared to childlessness? Compared to not having your baby? Because it takes someone that has been in that position before to actually understand the other side of not doing it. Yes, cost is a huge, part of this thing. And what we try to tell our clients is to pay for the IVF procedure first. Then the surrogacy payment can be on installment, highest 3 installments, to make it easier for them. Yes. Another way people can afford surrogacy is to probably, family intervention can come into play, where some people of goodwill can just support them to financially to have it. And there are some foundations as well that helps families to be able to do this.
Okay.
Thank you.
Okay. Thank you, Dr. Abiodun. Another issues in surrogacy that I want you to help us explain to our viewer at home is the issue of, I've seen a situation whereby a couple was telling me, Baba, can we see, because we want a fine woman to help us carry pregnancy, can we see the person? Even when I was even telling that, you can't see the person. No, we need to see. What do you think could happen if intending parent or the surrogate knows those couple that is helping them to carry the pregnancy?
So thank you very much for this question. These are part of the counseling stories and advice we give to intending parents. You see, quite a number of clients will always say that, can I know the person? Can I even know the donor of our egg? Can I know our sperm donor and all that? And the question I always throw back to them is this: have you ever considered the blackmail that may come up thereafter if you know this person? So it is better to be kept anonymous, because you can never tell. You see, and sometimes some of these people may just want to take advantage of those people, especially when they know that the family they are trying to help, they are well-to-do family, they are from diaspora, they are well-to-do, and all those things are not necessary. I've seen a patient before who said, can the surrogate stay with my family member for proper care? And I'm like, as how? It's as good as you bringing the surrogate to us then, within your family, because it's not necessary. If they start taking advantage of you, can you cope?
Yes.
So everything will still backfire on us and say, then why will you allow these people to know me and all that? So it is better, and for our viewers this night, it is better you don't bother about the kind of people or about the identity of the people that wants to carry your baby. What is important is the end game, is the end results. What you want is results. It's not if you want to enter a bus now from point A to point B, it's not all the time you want to know the driver. It's not necessary. What is important is for you to move from point A to point B. So whoever is carrying does not matter. We have signed to understand and to take charge of all those things on your behalf. So trust the fertility clinic to do that, and you won't regret it at the end of the day.
Okay, thank you, Dr. Abiodun.
Thank you.
Another issue I want you to please help us explain to our viewer at home is when we are talking about those who come from outside country,
Okay.
for surrogacy. What about issue of taking those babies out of the country?
So
How do you think that? Some of them keep asking that question, but me, I've not seen people. That is one of their fear. That how do I take this baby out? Because there was a particular time a couple was asking me, if I do surrogacy with you, and you must ensure the baby leaves the country. I said, look, no, because the only thing that I believe that is our responsibility to prove that the baby belongs to you. Whether they give your baby visa or not, it does not concern. So
Okay.
I want you to talk about why do you think this type of problem could come of taking the baby out of the country?
Okay. Actually, it's not as difficult as a lot of people think.
Okay.
And this information is for our diaspora, clients, that may be listening to us at this time. And I believe you want to put this thing on YouTube as well, so
Yes.
that over time they can
Okay.
watch and watch over again. Different countries with different policies on IVF and surrogacy. What do I mean? When surrogacy is done, and it's the egg and the sperm of the intending parents, is the easiest for intending parents. The reason being that someone from America, for example, that is a citizen, and we use his sperm, the husband's sperm, and the wife's egg, and both of them are citizens. It's simple. It's just to prove it to the embassy that this is our baby. What the embassy will do for them is to request for DNA. They will send them to a particular center where they do that. And once the result comes out that yes, the baby has the DNA of these people that are Americans don't joke with their baby outside anywhere in the world. So for such people, there's no issue. But if it's coming through surrogacy, what American embassy wants to do is, okay, bring the surrogate to us. Let us interview or interrogate the surrogate to be sure that it's not a case of child trafficking.
Okay.
And it's not a case of a surrogate being lured for financial gains to carry baby for you. Once you're able to prove all that, For United States, you are good to go. For some other countries like Canada, I think it's the same way. For UK, it's the same way. But for some other African countries, it may not be so difficult for them to take their baby away like that, because Nigeria being one of the leaders in Africa, and there are so many countries you enter in Africa that is visa free. So taking such a baby to such country is not a big deal.
Okay.
However, some problem can come from our own immigration here in Nigeria. We currently have a case in our hand that we just sorted out. About 2 months ago. The surrogate gave birth, and to get passport for this baby had to go to Abuja.
Wow.
With either the mother or the father, because one of them must be a witness when they are trying to take the picture of the baby. So NIN was gotten and all that, because a situation happened sometimes ago, a case of child trafficking, where someone just carried baby away from Nigeria and like that, and Nigerian immigration was really, really messed up that time. So because of that, if anybody wants to dodge that or avoid doing it through the normal protocol, when people get to the airport and they want to take the baby away, there's a way. Immigration has been trained to know whether the baby actually belongs to those parents or not at the point of taking the baby out. All they need to do is breastfeed the baby, and the whole thing will be exposed. So I advise intending parents, try to do the right thing. It's not as difficult as you may think. And for a country like United States or all this Western world, don't be in a hurry to take the baby out of the country. Most of the time, you have to wait for like 2 years, 1 year, 2 years, for the baby to be able to fly. Because flying to America, depending on the kind of flight you are taking, it can take like 13 hours, it can take like 18 hours, depending on the choice of flights, whether it's a direct flight to America or the one you have to join another one in between. So baby has to be strong enough so that baby can fly, because if you take the baby so early to such countries, especially America and Canada, the baby can be deaf by the time you get there.
Wow.
Because of the noise of the plane to the baby. But so most of the time people use earmuff for the baby so that baby is protected adequately because from the sound of the airplane. So it's not difficult, and there are lawyers that do all these things. Even our immigration here, they will request for the certificate of the company that did the IVF procedure, the certificate of registration. They want to see the agreements with the surrogate, and a lot of information you have to supply to our immigration for documentation, so that at their own level they are adequately protected. And it's better for intending parents because they are also protected, and they are confident that the baby they are taking is their baby.
Thank you, Dr. Abiodun. Another issue I want you to explain to us is this issue of this issue of age. You told us before that there's especially in Lagos State, there's age you could say you want to do IVF yourself, and when you pass that age, the best thing is to advise you to go and do surrogacy. Okay, what are the disease conditions that may warrant you advising a woman that please you can't carry a baby? Let somebody help you.
Okay, various conditions. Like I said earlier, I think I mentioned some of it. One of it is a woman is hypertensive and is not properly controlled.
Okay.
That's already an endangered species to carry pregnancy successfully. We've seen cases where people are pregnant and they have preeclampsia. That's BP being increased in pregnancy, which is not too good, because this could cause a lot of complications for the baby, if not even for the mother. So that's that. Diabetes is another situation that could happen, that we say, okay, because your diabetes is getting worse, you may not be able to carry this baby successfully, because even in hypertensive situation and diabetes situation, the medications being taken could be harmful to the embryo. To the embryo before the baby is fully formed. So that's a good condition. Another one is disease conditions. When I mean disease condition, I mean retroviral factors. A parent that has either HIV or hepatitis B, it's advisable they don't bother to carry. Nigerian government is serious about that. Lagos is more serious. They don't want to hear you give birth to a baby intentionally with HIV. Nobody wants to hear that kind of news. Lagos, and I want to tell our viewers tonight, as far as Nigeria is concerned, Lagos is the best place to do IVF because we are better regulated, we are better monitored. Before you set up IVF clinic in Lagos, of course, Mr. Abim knows the rigorous exercise you have to pass through, inspection upon inspection, monitoring upon monitoring, sometimes 2-3 times. This one is not correct. They want to ensure that we do it right. So Lagos don't compromise, and thanks to a farmer that is helping us to do this. And in Nigeria, no other state in Nigeria has been able to replicate that. So we are looking forward to better arrangements in the country where IVF procedure or fertility management will be better regulated. So HIV, hepatitis, and a leper now, you don't advise someone with leprosy, for example, because we don't want to transmit all these things to the unborn baby. The baby did not commit any crime coming to this world, so why should we want to inflict injury on the unborn baby? So these are some of the things that could happen that you say, no, you cannot carry.
Okay. Thank you, Dr. Abiodun. On a final note, I want you to use your own experience.
Okay.
Like, how do you break for the first time when your surrogate delivers? Okay. If your wife gets pregnant now, everybody will know that your wife is pregnant. But now, everybody has been saying that your wife is not pregnant.
Okay.
So when the surrogate delivered, how do you feel? How do you break the news to the people and your friend and everybody?
Thank you very much for this question. Honestly, a lot of things that happens to us as human beings is more psychological.
Okay.
Nobody have time for anyone.
Okay.
When you're not having the baby, does anyone care? In what way have they care for you to ensure you have your own? And excuse me, it's not everyone that asks about your well-being that actually care for you. So why do you want to pretend to people whatever you have done? And recently or lately, Redeemed Christian Church of God, they've been doing something that is fantastic to me. And that is most of the testimonies that come now during either during convention or during the Holy Ghost festival every year. People come out now to tell the whole world what they did. So telling us that you're the one that gave birth, who are you lying to? I think it's not necessary. And we have never covered anything. Okay. And I don't advise anybody to go through that route. Okay. The duty of people is to rejoice for you, not to begin to castigate you and say, why did she have to go through that? And excuse me, people forget so soon. Nobody cares. And nothing has meaning except the meaning you give to it. If you think people are watching you, it's up to you. If you think people are not watching you, it's up to you. So it's your problem, it's your challenge, and you have taken, the step to ensure that you have your own baby. So why should you care on how to break the news? Nobody is even monitoring you in the first instance. Of all the one we have done, honestly, it's only when we give birth that I announce to my family, and they're always happy for us. No one has actually asked us, no single person has asked us, how did you come about this? No. It's not necessary. You have a baby, you have a baby. Everyone now knows there are interventions that could be done, and we have done it. Okay. So that we didn't come to people to say, okay, please support us financially and all that, does not mean we are not taking appropriate steps to ensure we have our own baby. So who cares?
So that means your wife, like you rightly said, your wife do not start pretending as if she's pregnant.
Pretense is not necessary in the first instance, my brother. It's not necessary. We have our own baby. See, I've had opportunity of asking some of my clients that, okay, I will ask them, Google or ChatGPT for me, who is a mother? A mother is someone that nurtures a baby, not necessarily the one that births the baby. Yes, you can birth the baby and become a mother, but more importantly, it's someone that nurtures, that cares for that baby.
That is the mother.
Let me tell you, the 2 kids Obama had came through IVF. I repeat, Michelle Obama passed through several IVF, and the 2 children she had, the 2 girls she had today, came through IVF. And many other people. We have many of our celebrities in Nigeria as well, that today they are happy having their baby. Who cares how they came about the baby? People do adoption. It doesn't matter. Because most of these things, it's not our own cause. It's not like if people come to me now, and of course they are azoospermia, means they don't have any sperm at all. People can come up with this for no fault of theirs. It just happened. It could be probably when they conceived the pregnancy of that person, probably the mother took alcohol or smoke or something just changed the cells, and it happened like that. It's not your fault. So if it happens, it's grace of God. It's favor of God. So why should we need to pretend? To who? For how long? So I don't think people should pretend. Okay. Say it the way it is to encourage the multitude out there, and they will thank you for it.
Okay. Thank you, Dr. Abiodun, for coming to this 24-hour live conversation on fertility. We really appreciate you.
Thank you.
What will be your final note to viewers that are listening to you about surrogacy?
So to our viewers out there, honestly, I want to salute your courage for watching us tonight and for supporting Abim Fertility. He has done a good job by bringing some of us together like this. I can't remember when I come out at this time to face the camera to educate people. It's quite, it's been long now. Now, I haven't done this. The only way you can reward him is to not hide anything. If you have the challenges, come out. There are so many fantastic IVF clinics across the country, in Nigeria and across different states in the country, and they're doing a wonderful job. So you don't need to hide any longer. Sometimes there are so many emotions that goes into this. A lot of people, they will not take step, and it's when it's now getting late. That's the problem I usually have with most of the patients that comes around. Some people will tell me they've been married for 16 years, 20 years, and the next question is, what step have you taken? And some of them will say, I've been taking steps, I've been doing this, I've been doing that. You see, it's not over until it's over. And you can get your heart desire as long as you are ready for it. Only one thing that can prevent you from having it is money. Wow. As long as there's money, there are other various intervention methods that can be done. Some people even need just IUI, but because they refuse to come out on time, it will now graduate to IVF. But even the IVF, some people will not come out on time until it graduates to surrogacy. You know, some people will have fibroid, they did nothing to it, and the problem is, majority of our people, they faith it for too long. They keep believing, and I tell people, whatever you can do, God will not do it for you.
Yes.
It's the only one you cannot do, God will do for you. So I advise our viewers tonight, stop hiding, stop keeping silent, come out. Some of you is just counseling you need. And once you are counseled, you know, you get solutions to the challenges. Thank you.
Okay. Thank you, Dr. Abiodun. God will bless you. And I believe when next we call you for a chat like this, you will honor us. Thank you. God bless you. We
Thank you very much. Thank you, viewers.
When you get to
keep watching our 24 hours broadcasts. So I'm sure a lot of people must have been sleeping tonight. Maybe tomorrow they'll wake up and to see. And thank you.
Thank you, sir. You are welcome.
Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you you're live on 24 Hours Fertility Conversation with Abim Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening to us. We love you from Abim's Fertility and Andrology. Good morning, good afternoon, good evening, wherever you're listening to us. Hope you're cool. My name is Ola Onobajo, and I'm so happy right now to tell you are live on 24 Hours Fertility Conversation with Abim's Fertility and Andrology. A 24 hours live session dedicated to answering your burning fertility questions. Please don't go away. We will be right back. Thank you for listening.